Um, Thanks again for the invitation. My name is Luis Carlos Arquez, and this is the spinal erector muscle plain block under direct vision for postoperative pain management in spine surgery. This is a preliminary report. We need to know that in the postoperative pain, several nociceptors and mechanoreceptors located in these tissues are capable of transmitted pain through the posterior branches of the spinal nerves connecting to the sympathetic and parasympathetic autonomic nervous system. Thus, mechanical irritation, compression, or postoperative inflammation are very important causes of pain in the neurosurgical patient. Spinal surgeries are normally associated with early moderate to severe pain during the postoperative period. Proper pain treatment improves functional outcome, early ambulation, and discharge, as well as prevention of chronic pain. Direct spinal plane block under ultrasound guidance is a procedure when we placed the transducer against the vertebral level in the prone position and move approximately 3 centimeters lateral to the spine's process. The erector spine muscle and transverse muscle were then identified, and a needle was advanced through the interfacial plane between the erector spine and underlying transverse process. Thereafter, the local anesthetic was administered into the space. This procedure is used in the postoperative pain management in various surgical procedures like breast surgery, prostate surgery, and even in rescue therapy in laparotomy. There is a decrease in pain intensity and need for postoperative opioid use with this procedure. So, it is evidenced that the volume injected at the level of the posterior part of the forelumbar transverse process is constantly distributed in the erector spinal muscle between the lumbar vertebra from L2 to L4, L5, and involve the posterior branches of the nerves corresponding spinal. Lateral spread is limited to the erector spine muscle without spreading to the quadratus lumbar. At the lower lumbar level, L3, L4, L4, L5, and L5 S1, it is common to observe a minimal extension to the anterior part of the transverse process and later to the psoas muscle, but without reaching the anterior branches of the spinal nerve at this lumbar location. This is the mechanism of drug dissemination. Uh, we found we can found that dorsal ventral branches of the spinal nerve can be reached by this anesthesia. Also, visceral and somatic pain can also be reached by this anesthesia. In this figure, demonstration of these anatomic structures. If you can see in V, this is you can see how the spread of injectant in the study of Schwartzman. In the C image, you can see how the spread of the injection is spread in this study, that is in the Ivanovsky and all, and so on with all of these three three more images. So with that in mind, we describe a series of 40 cases surgically operated on the dorsal and the lumbar spine with who underwent spinal erector plane block under direct vision in the proximal third of the surgical wound with 20 millimeters of 0.5% bupivacaine and with epinephrine. The severity of the pain was assessed during the first 48 hours after surgery, and we used the visual analog scale of pain to assess and to evaluate the pain in this patient in the same period. Also, we registered the type and rescue analgesia used in the same period of time. This is the registry with the surgical intervention. What kind of surgical did the patient have? So it had a dorsolumbar spine joint surgery or lumbar spine surgery. We use in both cases the 20 millimeters of bupivacaine with epinephrine. There was no adverse effects, and this was the pain scale at 48 hours following, showing that there was a reduction of the pain in the patient that we used this technique. There was no rescue analgesia used in all of these patients, and the need of strong opioids like hydromorphone or morphine was very low in these patients. So this block under direct vision at the dorsolumbar level seemed to contribute to pain control during the first 48 hours of the postoperative period in patients that underwent to dorsolumbar or lumbar spine arthrodesis. This is a promising and effective method. We need to randomize the comparative and pharmacokinetic control studies to have a clear understanding of the rational anesthesia technique